In most developed healthcare systems, access to medical professionals is assumed to be constant. Hospitals, pharmacies, and emergency services form a network that supports everyday medical needs. However, in certain environments, this infrastructure can become unstable. Situations such as prolonged power outages, economic crises, supply chain disruptions, or remote living conditions can limit immediate access to medical care. In these scenarios, individuals often rely on practical knowledge to manage minor injuries, recognize symptoms, or stabilize a situation before professional help becomes available. Printed medical references designed for non-professionals have historically served this purpose. These resources typically provide simplified explanations of symptoms, basic treatment procedures, and guidance for handling common health situations. The product examined in this video falls into that category. It is presented as a structured medical reference intended for household use. The Home Doctor, Practical Medicine for Every Household is a medical reference book designed for non-professional readers. The guide contains approximately 304 pages and is structured around a collection of health-related scenarios and basic treatment procedures that may occur in everyday life. The book is attributed to medical contributors including Dr. Mabel Nieves and Dr. Rodrigo Alterio, with additional collaboration credited to Claude Davis. Its content is organized into chapters focused on different areas of the human body and different types of medical situations. These include topics such as skin injuries, respiratory illnesses, dental infections, cardiovascular symptoms, digestive pain, minor surgical procedures, infection management. The material combines written explanations with diagrams and step-by-step illustrations. These visual elements are intended to help readers identify symptoms or understand procedural steps more clearly. Rather than presenting a continuous narrative, the book functions as a structured reference manual. Readers typically navigate to a specific section when encountering a particular health concern. The primary interaction with the product is through consultation. A reader may open the guide when experiencing a symptom or when preparing for situations where professional medical care may not be immediately available. Within the chapters, the book presents several types of information. First, symptom identification. Certain sections describe observable signs associated with medical conditions such as heart attacks, strokes, arrhythmias, infections, or respiratory illnesses. Second, household medical preparation. The guide outlines examples of medical supplies and medications that may be stored in a household medicine cabinet. Third, step-by-step procedures. Some chapters describe basic actions related to wound care, infection management, or minor physical conditions such as ingrown nails or skin infections. Fourth, observational diagnostics. The book includes diagrams of body regions used to help readers identify the location of pain or inflammation. For example, an abdominal evaluation diagram divides the abdomen into multiple sections that can be examined through palpation. Finally, the guide also discusses non-clinical health practices such as stretching routines, oral hygiene responses, or ways to observe changes in bodily signals. Readers are expected to interpret written instructions and apply them when relevant. The guide does not replace formal medical training and is positioned as a household reference. This type of guide typically aligns with readers interested in practical preparedness. Examples may include individuals living in remote areas, households preparing for natural disasters, people interested in self-reliance or emergency readiness, readers interested in medical reference materials. It may also be used by individuals who prefer having printed documentation available in situations where internet access is unavailable. Because the format is static and text-based, it does not require electronic devices once the material has been downloaded or printed. This allows the information to remain accessible in offline environments. Within the broader category of health resources, this product belongs to a long tradition of household medical manuals. Similar references have existed in various forms for decades, often combining simplified anatomy explanations with first aid procedures. Compared with modern digital health platforms, the book format offers a different form of accessibility. Digital platforms often provide updated medical guidance and interactive diagnostics, but they rely on internet connectivity and electronic devices. Printed manuals, by contrast, function as static repositories of information. They can be stored physically and accessed without electricity. The Home Doctor positions itself within this reference category by combining general medical explanations with procedural illustrations and preparation lists. As a result, the product functions less like a course or training program and more like a structured handbook intended for occasional consultation. For viewers interested in examining the source material directly, The instructional documentation referenced in this video is available through the link in the video description.